Most men think waking up at night to pee, a weak urine stream, or taking longer in the bathroom is just normal aging. But what if I told you these are actually early warning signs your prostate is enlarging and ignoring them now could lead to serious problems later? Today, we're re-exposing the silent symptoms of an enlarged prostate that millions of men overlook every single day. Here's the tricky part: BPH doesn't appear overnight. It creeps in slowly, so slowly that most men adapt to the symptoms without realizing something is wrong. You start planning your day around bathroom access. You avoid long drives. You stop drinking water before bed. In your mind, this becomes your new normal, but your body has been sending warning signals all along. One of the earliest signs most men ignore is a change in urine flow. Maybe the stream isn't as strong as it used to be. Maybe it starts and stops. Or maybe you feel like you're done, but then a few drops still leak out. This happens because the prostate surrounds the urethra, the tube that carries urine out of the body. As the prostate grows, it slowly squeezes this tube, making it harder for urine to pass freely. Nighttime urination is another red flag many men brush off. Waking up once in a while is normal. But if you're waking up 2, 3, or even 4 times every night, that's not just aging, that's your prostate interfering with your sleep cycle. Poor sleep doesn't just make you tired, it affects hormones, metabolism, mood, and even testosterone levels, creating a chain reaction that impacts your overall health. Some men also notice they have to strain or push to start urinating. What makes BPH especially dangerous is that pain is usually absent in the early stages. There's no sharp warning signal, no sudden emergency. But what apps absolutely are, and why ignoring them can quietly lead to infections, bladder damage, and even kidney problems over time. Instead, they show up as changes in daily comfort, energy levels, and even confidence. One subtle but important sign is urgency: the sudden, intense need to urinate that feels like it comes out of nowhere. You might be fine one moment, then desperately searching for a bathroom the next. Another warning sign many men ignore is post-urination dribbling. Even after you think you're finished, urine leaks out later, sometimes minutes afterward. But this symptom isn't about poor hygiene or weak muscles, it's a mechanical issue caused by urine getting trapped due to prostate pressure. Frequent urinary tract infections can also be linked to an enlarged prostate. When urine stays in the bladder too long, bacteria have more time to grow. Many men treat repeated infections but never address the root cause. Over time, these infections can inflame the bladder and worsen symptoms, creating a vicious cycle that becomes harder to break. Sexual changes can also be an early clue, though they're rarely connected in a man's mind to prostate health. Reduced semen volume, weaker ejaculation, or discomfort during ejaculation can occur as the prostate enlarges. Because the prostate plays a key role in producing seminal fluid, changes in its structure can affect sexual function long before serious urinary symptoms appear. Another silent issue is the emotional toll. Constant bathroom anxiety, poor sleep, and fear of leakage can slowly chip away at confidence. Men may become irritable, fatigued, or less motivated. This stress can raise cortisol levels, which further disrupts hormones and worsens inflammation, again feeding back into prostate growth. If BPH continues unchecked, the bladder has to work harder and harder to push urine past the narrowed urethra. Over time, the bladder wall thickens and loses flexibility. This can lead to sudden urinary retention, where you feel an intense urge, but can't urinate at all. This is a medical emergency and often requires catheterization. In more advanced cases, pressure can back up toward the kidneys, interfering with their ability to filter waste properly. Kidney damage doesn't happen overnight, but it can develop silently if prostate enlargement is ignored for years. This is why early awareness matters so much. Lifestyle changes, targeted exercises, diet adjustments, and medical guidance can slow or even reverse symptom progression for many men. This hormonal imbalance can stimulate prostate tissue growth. At the same time, chronic low-grade inflammation driven by poor diet, stress, lack of movement, Another often ignored factor is stress. Chronic stress elevates cortisol, which interferes with testosterone production and promotes inflammation. Stress also tightens pelvic floor muscles, making urination more difficult. Physical activity, particularly walking and light resistance training, improves circulation and insulin sensitivity, both of which are linked to better prostate health. Gentle pelvic floor awareness, not excessive tightening, but learning to relax those muscles, can also improve urine flow and bladder emptying. Sleep quality matters more than most men realize. Poor sleep disrupts hormone regulation and immune function, accelerating prostate issues. Nighttime urination then further disrupts sleep, creating a loop that worsens symptoms over time. Breaking this cycle early is key. The most important takeaway is this: enlarged prostate symptoms are not something to ignore or feel embarrassed about. They're signals, clear messages from your body asking for attention. The earlier you respond, the more options you have and the better your quality of life can be. Men who take action early often avoid medications or invasive procedures altogether. They regain restful sleep, confidence in social situations, and control over their daily routines. And it starts simply by recognizing the warning signs and deciding not to dismiss them as just getting older. If there's one thing every man should take away from this, it's that an enlarged prostate doesn't happen suddenly, and it doesn't have to control your life. The early warning signs are subtle, easy to ignore, and often brushed off as normal aging, but they are your body's quiet request for attention. Listening early can save you years of discomfort, disrupted sleep, and unnecessary stress. Prostate health is deeply connected to how you live every day. Movement, diet, sleep, stress management, and awareness all play a role. Small, consistent changes made early can protect bladder function, support hormone balance, and slow or even prevent symptom progression. And just as importantly, taking action restores the confidence to travel, sleep through the night, and live without constantly worrying about the nearest bathroom. There is no weakness in paying attention to your health. In fact, strength comes from awareness and responsibility. If you've noticed any of these signs in yourself, don't ignore them, don't feel embarrassed, and don't assume nothing can be done. The earlier you respond, the more control you keep. Your body is always communicating with you. The question is whether you're willing to listen,